Welcome to Brain Balance Live. I hope you guys are jamming to that happy tune. How about you, Heather? Are you starting off your week good?
Oh yeah, I'm always jamming behind the scenes until we go live. I love it.
Just happy. It's just a happy little tune. And
It
you
is.
know what? Who knows if you're going to touch on this today, but supposedly moving your body and dancing, even if you don't feel great, is going to help you feel a little bit better. And today we're going to be talking a little bit about how we can make ourselves feel a little bit better, or troubleshoot at least something that is very, very important to us. What is that, Heather?
Mental health.
Yes.
This is such a broad topic. This is a Mental Health Awareness Month, and this is something we talk about all the time. But I think we need to do a series on it, because as I was putting this together, it's like, yeah, we can't talk about everything we need to in 30 or 40 minutes. So this will be the first show, and we'll definitely have one or two more shows to follow up on with more specifics on certain topics.
I love that. And I feel like you're so right. There's so many different aspects and types of mental health that we're all dealing with, different forms of different things. So this is going to be so helpful to all of us in one way or another, as a parent, for ourselves. But before we get started, I do just want to let you all know, in case you have not caught our show before, or if you're watching this on the replay, my name is Jen, and I'm a busy mom of three. I'm a brain balance mom. And every week we come here to talk with Heather. And as you can see her handle there at The Hidden Churn, you can follow her on all your favorite social media platforms. And she's going to just talk to us. She's a board certified cognitive specialist. She's a therapist. She is one of the National Autism Summit speakers. And recently our Brain Balance centers have gotten an awesome accolade. Do you want to tell everybody what we've recently gotten?
Yes, Cambridge joined Harvard. Cambridge Brain Sciences joined Harvard in researching our program, two separate studies. And they reported the wonderful improvements we achieve in all kinds of executive function skills, reasoning, attention, memory. They looked at 12 different areas, and we helped kids achieve growth in all 12 areas they looked at. And then, of course, Harvard did a 10-year study on our program, and shows not only the improvements we make, lower ADHD index scores, better emotional regulation, et cetera, but also that that growth is sustained because we actually structurally change the brain. So
yes. So something we've known all along, of course, but it is nice to have those credits, those feathers in our caps, huh, Heather?
Definitely, because some of the things today we're actually focusing on the role of neurodevelopment in mental health. And these are not common sense things unless you kind of have a neuro background. There's a reason music does so much good for us that we can talk about. But we were also in the journal Mental Health and Clinical Psychology, in the vast improvement we get in decreased anxiety and worry and better moods and emotional regulation, based on knowing what we know about the sensory motor system and development. And to that point, Dr. Thomas Enzel, he is the former president of the National Institute of Mental Health, said psychiatry should be renamed clinical neuroscience, because you just cannot tease the two apart. He said that in a conference in 2014 at Stanford. And he also said, we need to catch up to what science has been telling us for a long time. And that is, we must drive the communication in the various parts of the brain to improve these things. So we're going to look at that today. And then in some follow-up weeks, we're going to do deeper dives into certain things like depression. And is this depression, or is it emotional hyperarousal with my kiddo with ADHD, for example? And all of these things apply to adults too, as you said in the beginning. So our brains are neuroplastic. They are malleable. By doing the right things, we can learn how to handle emotions, just as we can become better in reading and math and attention and so forth. They all go together, and we can drive the communication in the brain regions where that needs to happen. So that's what we're focusing on today. So we can kind of move on and to the next slide.
I love that. But working with brain balance centers, I'm actually in Florida, so I don't have the gift of having Heather close by, but brain balance was the first time I had ever experienced that thought of, we can actually rewire this pathway. We can, if through this work, we can actually change the way the pathways go in the brain, which was just a huge, like, my mind was blown. So I love this.
Yeah, I mean, Harvard did functional MRIs on the brains of the students who participated in that study before the program and after, and they see the improved connectivity that we achieved. So they saw the structural brain changes as well as the symptomatic improvements as a result of those brain changes that we achieve. But it's just important to know that developmental gaps often lead to anxiety. We know this with certainty. There has been a lot of research on this, and some of the very specific things are some of the, like if you look at these pyramids, this is development. When families come into us, we want to know what the symptoms are, but we need to know why kids are having those symptoms so that we're not just putting a Band-Aid on the issue, because that doesn't fix anything. It doesn't achieve permanent change. So when you look here, the foundation of our developmental house are primitive reflexes. These are little survival mechanisms. We're all born with at birth. They serve a purpose because we come out of the womb in survival mode, been in this safe little place, and all of a sudden we're out in the scary world. These are supposed to go away at a very young age. And several of these can really, they're involved in anxiety to one extent or another, but the one that is very directly related is the startle reflex. You know how babies, what was that sound? Bright lights, and they tend to throw their hands back and what? Well, if we continue to have that, these are supposed to be what's called integrated, really meaning they don't impact our function anymore because we continue to grow and we can use intentional methods of getting our wants and needs met. We don't want to act on reflex anymore. When this happens, kids go into fight or flight all the time. I mean, that's what anxiety is to a large degree. So the startle reflex, it doesn't mean kids when they're 12 would still be throwing their hands up like this, but it does mean I don't feel safe and I might be over-responsive sensory input, decreases concentration, might be aggressive. All kinds. Some kids do the opposite and they withdraw because it's the fight, flight, freeze. There are many components to the fight or flight system, but too sensitive, to sensory input. It might be the tags or seams on clothing, the type of material. It might be gagging at foods. It might be bright lights. It could be sounds. It doesn't have to be all of them, but somewhere in there is, I don't know how to process the sensory input correctly. I don't feel safe. And I go into this anxiety mode, aggression, emotional reactivity. Perception of body position and movement. This is one reason why music is good for it's good for the growth of mental health. We know that we need body awareness and knowing where we are in space. And I can really perceive my position and whether I'm moving and that thing I'm looking at is still or vice versa. I can't see that. But there is, you see the body coordination and timing. We learn to keep time in a sensory motor way before we have time concepts up here that help me have time management, organization, prioritizing, task initiation. If I don't have that, what happens? A lot of times it's at the last minute and I'm scurrying to get it done. We might have perfectionism, a lot of those, opting out kinds of things going on. But moving to music not only is good auditory stimulation where you get rhythm and timing in that way, but you're also using both sides of your body to improve coordination. We want lots of jumping and, whether it's trampolines, hula hoops, just get out there and move, swing, do what's called heavy work, lift, push, pull, do somersaults, things that get you in motion, as well as using both sides of the body, because every time you use both sides of your body, the hemispheres of the brain are communicating with each other and it can grow new neural pathways. And I have a slide where I'm going to go into the inhibition. Any of you out there have impulsive kids, very, very tied to anxiety, and we'll talk about that. And we talk about the body-brain connection. If the development of the brain has gaps in it, as you can see on the right side of the screen here, that there are gaps in development, then it also impacts even physical growth and development. We sometimes have kids who visibly grow years in the number of months they're here because the brain starts communicating, they start sleeping better, eating better, and the whole system is just they're digesting food more efficiently. But our fight or flight, our nervous system is what processes sensory input. And we have the sympathetic system, which is when you're going into fight or flight, and the parasympathetic system, which is your rest and digest phase after coming down from that anxiety-provoking situation. So these are some things that have very directly been linked to anxiety. I can tell you, as a little girl, having visual perception and processing issues, because I couldn't take in the whole visual field, I felt like things were popping up out of nowhere. Any of y'all out there who have been startled before, somebody opens a door and they're just right there and you didn't know they were there and you jump, but can you imagine that throughout your all day? Sound like they're coming through a megaphone. You feel like you live in a 3D movie. You don't really have your bearings about you in space. I mean, those are going to get your motor churning.
Yes, I can totally imagine that. Like, even just feeling it one time, if that was happening over and over again, that's overwhelming.
It is. And the tricky part is that a lot of individuals don't lash out. I mean, and you'll understand why in a minute. Sometimes it's the ones who try to blend into the woodwork. They're withdrawing from the situation, and that it can still be anxiety, and not necessarily what we think of when we hear that word.
Yeah.
Okay.
All righty. I think we're going on to the next one. Yes.
Yes.
Let's do it.
So we have talked about the guard dog of the brain before, but I thought, let me do it a different way this time. So these are some different parts of our brain that are extremely tied to mental well-being and emotional well-being. So we've talked before about how sensory input comes through the brainstem. And you see here, the brainstem is for breathing, swallowing, heart rate, blood circulation. What happens when sensory information comes through the brainstem that I'm misperceiving? Heart rate might go up, sweaty palms, dilated pupils, racing heart, sweat, all the kinds of things that some kids, even when they're not in a moment of fight or flight, you might notice that they might start having body odor at an age younger than expected. They're sweating all the time. Their hands are moist and clammy. There are other, it also can be tied to digestive issues. They have diarrhea a lot, as an example. But sensory information comes through there, and I am not perceiving and processing it correctly. So then the amygdala, guard dog of the brain, says you're not safe. Exactly like it would tell us we're not safe when we truly are in a dangerous situation, someone coming up on us in a dark parking lot. Fight or flight serves a purpose. It does not distinguish between real threat and what we misperceive in our sensory motor world. Very important to note. And kids go into fight or flight just like we would to get away from the guy who's trying to attack us. When that happens, information does not make it to your prefrontal cortex, where you have intentional, deliberate, logical, analytical thought. You don't have a pause button in this moment where you can make good decisions, plan your next move. Doesn't happen. So if you're trying to reason with a child in this moment, or a spouse or anybody, because this applies to all ages, those words are not going to penetrate. You need settling time. It can take much longer than you can tell on the exterior of a person for them to be back into a place where they can really have a meaningful conversation with you about whatever's happening.
I sometimes need a full night. I know people say don't go to bed angry, but sometimes I tell my husband, listen, I just need to go to sleep right now, and we'll talk about this in the morning. And that's just okay with me.
It is to your advantage for us to wait till tomorrow.
That's right.
But here's something interesting to keep in mind too. The hippocampus, memory and learning. What is going to happen when kids are in a fight or flight response in a noisy classroom? Lots of visual fray, lots of noises, just kind of feeling woozy. A lot of kids will complain of tummy aches or headaches, and it looks like they're trying to get out of school, but hippocampus, that when you think about memory, sometimes memories get encoded incorrectly. So even if you talk about it later, that memory is stored a false memory can be stored as if it happened. I've shared before a long time ago about a woman who had photographic memory, and on 9/11, she has a false memory because there was a chance that some of her loved ones were in those towers. And so she remembers seeing things that she literally could not have seen from her office with detail. And she does not have a memory issue. That is when emotion gets involved. So imagine, just like if we've had a traumatic experience and there might be triggers, certain cologne, certain sounds, anything that's associated with what happened to us. These kids or adults can often have triggers for false memories, and then avoid going to a place based on something that really didn't happen. And it looks like they're being unreasonable.
Wow.
But the hypothalamus is also involved. We got, hypothalamus, think about all the hormones involved, emotional regulation, sleep, appetite, temperature, certain types of drive. So back to what Dr. Thomas Inzel said. I mean, how we must have all of these parts of the brain communicating correctly with one another. You can see how a breakdown in any link of this chain is going to cause some issues.
Oh my gosh, absolutely.
Okay. So what does the fight, flight, freeze, or fawn look like? And fawn is not something we hear about as much as the fight, flight, or freeze. But stress responses, when you go into fight mode, I'm in danger, you might see rage, anger, irritability, frustration, irritation, moving toward. That might be when somebody's throwing a chair or hitting someone. Physical symptoms, they might have nausea, they might even vomit, they're stomping or kicking around, just a taut body, but knots in their stomach. The flight, that is another, I don't want any part of this, so I'm going to flee the situation. That looks like, opting out, I'm getting away from this. This can happen with tests, it can happen in social situations, and these kids often get called lazy, unmotivated, task avoidant. But why are they? It's not based on laziness. We don't want to attribute negative personality or character labels to these kids when they are having a physiological response based on neurodevelopment. But anxiety, worry, fear, panic, perfectionism. We did a whole perfectionism show. If anybody missed that, that might be really helpful. But a lot of this is when, okay, I'm overwhelmed. And this is not just with autism, but stimming. I go to a restrictive, repetitive movement. I'm overwhelmed, so I kick into habit gear and do something, whether it's twirling my hair, picking at my skin, my lip, biting my lip, anything that's a repetitive movement to check out of the situation. My body checks out, my brain follows. When that happens, we are not growing new neural pathways. They are going to comfort of a habit. Some people will actually do a habit. Think about maybe compulsive shopping or something like that, certain addictions. But you feel trapped, tense. You might be just fidgeting, restless, wide eyes. You might see a lot of foot tapping or this kind of thing going on. Freeze. Stuck. I'm just immobilized. If you have kids who are really lethargic, they're spaced out, depression can come in here, a sense of shame, just shut down, dread. You might see pale skin, their heart's pounding, restricted breathing, or they might even hold their breath. But the other response that we don't hear as much about, and you can see this a lot with trauma, but other types of anxiety also, people pleasing, avoiding conflict, prioritizing others' needs over their own, difficulty saying no, and really have a hard time setting boundaries. So the way I deal with it is to just be your yes man. I'm a chameleon. Oh yeah, you want me to do that? Sure, no problem. You're into this, me too. That can really get people into some trouble. You can think about some risky behaviors and things like that that go in with that.
Oh yeah.
So, all right, we can move on.
I definitely relate to that hard. I have been a pleaser since I was a child by nature.
Yes. But we've kind of given you an overview, but just keep in mind this, I can't say this enough times, there are so many individual differences. Not all anxiety looks the same. There is a whole lot of ruminating on things, besides the disconnected, I can read your mind. That classmate doesn't like me. That's a protective mode because I don't feel safe. Depersonalization. I'm going to feign apathy. I don't really care. Disqualifying the positive. I don't like anything about my schoolwork. Not a very effective filter. Filter out all the positive. All or nothing thinking. This is always boring. If they would give it a chance, maybe they would actually like it. I always say this word wrong, you know that, but making a catastrophe out of, mountain out of a molehill. This will be the worst assignment ever. This is the worst day ever. This is a lot of cognitive inflexibility. And that comes also largely from lack of brain connectivity. The more pathways of communication we have, the more we can see different shades and degrees of situations. Hi, Tim. Good to see you. Thank you so much for your comment. He's awesome. We grow new pathways of communication, then we can take on other points of view. We can appreciate another perspective, even if we don't agree with it. We can say, maybe I did something to upset this. They don't like what I did. Maybe it's not that they don't like me, right?
Yeah.
So be looking. That's why I always talk about logging, because what it looks like in each individual is going to vary, of course. All right, we can move on. Now, one of the things I said I was going to come back to is impulsivity. Impulsivity is the ability to have response inhibition, to not be impulsive, is one of the first executive functions that we start growing. When you look at functional, emotional, developmental capacities, the ability to sit still, be alert, and attend comes before purposeful engagement, all these social skills, language skills. So if I can't sit still, be alert, and attend, if I cannot ignore that distraction to hone in on what I'm supposed to pay attention to, I might be impulsive. The relaxed brain, where we should live most of the time, I face a situation, we hit a pause button. Let me stop and think about this before I speak and act. What are the consequences? What are some solutions? And let me brainstorm those and then think through, if I do this, then these are some potential outcomes. And then I choose from all of those and make a logical, analytical choice. That's what we want. If we are in fight or flight mode. So impulsivity really is so tied to anxiety in the research for a reason. If I'm in fight or flight, I don't have a brake pedal. I need to act quickly.
It's so easy to see impulsivity in a negative light, because like it happens so much in our house that like it's so easy to label it as like this bad behavior. And when you think of it this way, it makes so much more sense. I'm constantly saying, like, when you're about to make every decision, stop and think, what would mommy say right now?
And one of the tricky things too is that when individuals who have body awareness issues are escalating, they may not feel those physical signs that are warnings to them that, hey, take a minute because you got a knot in your stomach. Your breathing is getting faster. We subconsciously notice those things and be like, okay, I'm in a fight with my spouse and I'm getting escalated. I need to take some deep breaths. I need to take a time out for a minute and come back so I don't say something I'll regret.
Yeah.
It is, Tim. Yes. It is such a courageous show of strength to ask for help. And I'm so glad you said that, because we're talking about mental health, and so many people don't seek help for this. There should no longer be stigma, but sometimes there is. Mental health is not weakness. I put up a quote yesterday about how if you're struggling with mental health issues, it does not define who you are. You feel the rain, you walk in the rain, but you are not the rain. And that is a quote I put up. And it's really important to note that it is important to, if we stub our toe, we don't want somebody else telling us it doesn't hurt or it's not that bad. We know our toe hurts.
Yeah.
So many of these things are invisible if you don't know what to look for. And sometimes even if you do, individuals get really good at hiding it until maybe it's too late. Or they just go through life suffering.
I would never be ashamed to go to a doctor for a cold or for, a symptom that was causing me a great amount of pain that was physical. You would never be ashamed to say, oh, I had to go to the gastrointestinal doctor because I was having some pain. But we all, it's been societally, we associate mental health care not as the same thing. And it's exactly the same thing. It's it's a body function that is having an issue.
And I think that there was a study of a lot of end-stage cancer patients. I mean, they know that death is coming, and they were depressed. I mean, they were diagnosed with depression, and they were asked, which is worse, your stage 4 cancer or your depression? And substantially more people, I mean, by a landslide, said the depression was the most difficult part. Imagine that. That says a lot.
Yeah.
But really, I like for pretty much any trait for any characteristic we have, there is a positive to all of it. Impulsivity is also spontaneity, but a lot of times it's the thing that gets us in trouble, and we do need a brake pedal. But it might be easier to be patient with individuals who are impulsive if we think about it as the stressed brain. You cannot use your brake pedal when you're in a stress response. Why? From ResearchGate here, you see reward processing. Individuals struggling with impulsivity don't process rewards. They don't even have time to think through it in the first place. But even those things, that would be me thinking about a consequence of pausing. And what would the consequence be? You know, oh, this is a better reward, so I'm going to do the right thing, or make the better choice. Working memory. Y'all have heard me talk about working memory on other shows, but working memory is problem-solving memory. It is not me spouting off a few words and seeing how many you remember in 30 seconds. It is, I'm facing a problem. Oh, wait, I faced something like this before. Let me pull that information from my background knowledge, use it, manipulate it to solve the task at hand, and then go store it back in long-term storage. Working memory is not just for academics. It is not just for social situations. Sometimes the emotions that we're feeling are so large, you go into overload, and you don't even have room, because your emotion is so big. You don't have room to even in your brain to think about how it's making the other person feel. And then it appears that they're lacking compassion or empathy when that's not the case. They did not have room to consider that, because we have a finite amount of space on our mental sketch pad when we're working through problems. And understand that with ADHD and a lot of other neurodevelopmental challenges, emotional hyperarousal is a primary issue with that. It should be on the same list with impulsivity and attention distractibility issues and fidgety this is just as key of a component. So it is not a heart thing. It is not a character thing. It is a brain thing. So it is very tied to motivation. And so all this lazy task avoidance and timing, back to the rhythm timing. We get rhythm and timing in our body. We grow a sense of time. And then I get that whole concept of waiting. Some kids don't wait because they don't even know what that means. That's a very abstract concept. So you can see many different cognitive skills are involved in inhibition, hitting that pause button. It is a higher level developmental skill. And not only does it have to be there, but all of these skills have to work in coordination and timing to come up with the best outcome.
Oh,
okay.
Yes.
All right, let's move on. And so we have looked at how issues with neurodevelopment can lead to anxiety, but also know that toxic stress then in turn can affect brain architecture. And brain architecture, which is what Harvard calls it, is really when you're thinking about all of these superhighways of communication that we need to build. So you are having neurodevelopmental issues leading to anxiety. Chronic anxiety then impacts future growth of neural pathways without doing the right things. And then over time, you have lower stress tolerance. Y'all know you're having one of those months or something, and then one other thing happens, you're like, I can't take anymore. But that leads to more impulsivity, fighting, just opting out, difficulty with your sense of self, relationships, self-regulation, social skills, verbal, nonverbal communication, linking emotions to the context. Sometimes kids can memorize answers to situations. This means happy. This means sad. When this happens, I am supposed to do this. They know the script, but then they're faced with a real world situation and they don't get really the application of it. There's plenty of research about how individuals who are prone to anxiety sometimes perceive anger in the faces of those they're engaging with if it is anything other than overt joy, if it is monotone, if it is flat, if it is boredom, disinterest, it's anger. So they pick up on anger quickly, but they also misinterpret many other emotions as anger. Very important to know. So we want to use slow speech, fewer words, fewer gestures, be the calming presence for them, because they may misperceive, and try to have some inflection in your voice also.
Do you feel like as like an adult who struggles with some of these things, or like even if you have children that struggle with some of these things, do you feel like sometimes we've talked about feeling hopeless before, in some of these scenarios, but these pathways in the brain, like as long as we're working on them, can we continue to help them throughout our entire lives? It's not like we get to a certain age and it's like, we're broken forever. We're never going to work again.
No, my dad lost the right hemisphere of his brain to a tumor at the age of 61. And I saw neuroplasticity at work in him, meaning I saw his left hemisphere growing neural pathways to take over functions that were traditionally taken care of in the part of the brain he lost. As his daughter, I was grateful. As a neurology person who's been studying this my whole life, it was fascinating. Mostly it was just wonderful as his daughter, but I couldn't help but be fascinated. If my dad can do it at 61, we can certainly do it anytime. There is just more and more research coming out all the time. We've known this for decades, but it's like, okay, that wasn't enough. Other people keep studying it and just reconfirming how amazingly neuroplastic. But the other good news about neuroplasticity, it's not only that we can grow new neural pathways for better communication in the parts that aren't communicating well, but the more we start not using the pathways that aren't serving us the way we need them to, those start getting pruned away. It is not just about how many pathways of communication in the brain we can grow. We want efficiency. An efficient brain prunes away. We don't need that knee-jerk response anymore. Get out of here. So that's exciting too.
Yeah, very exciting. I think it gives all of us hope when we can feel down on ourselves. If we kind of have a bad day, or even if they have a bad day and maybe we are not on our best behavior and we break all the rules and say all the wrong things and have zero patience, it's really comforting to know that like, that doesn't necessarily restart everything. It just means you have to keep trying.
That's right. That's right. And really, the research about neuroplasticity started coming out in about the 1950s and is in the 60s. So when I was going through, when they finally figured out that I was legally blind and the doctors really thought it was too late. But I'm like, I'm going to try anyway. Whatever y'all tell me to do, I'm going to do it. That was decades ago. So now we know. They thought it was just a miracle. It was neuroplasticity, Amazing. And me being able to learn skills that they thought I was just too old to learn, when I was like 6, because visual perception and processing grows very early. So, at 6 or 7, they thought it was too late. But you can just see that it negatively impacts problem solving, understanding cause and effect, flexibility, purposeful behavior. Okay, let's go on. So we've talked a lot about some developmental things. And so the way I want to kind of end this is talking about, because I get questions about this a lot, and it's a great question, is so what if I as a parent have been through trauma in my childhood? Is that going to impact my kids? And you can see on the left there, yes, for every adverse childhood experience that mom and dad have, it does it puts kids at a risk. But if you have worked through it, if you have a cohesive personal narrative about what happened, it's not just hodgepodge in your head. You've made sense of it. You've found meaning in it. You've used it to help you grow, and you are not struggling with these difficult emotions. It doesn't mean you have no difficult emotions about this, but they're not eating away at you to a point that it's difficult for you to be engaged with your kids. It doesn't have to impact your kids. It is not what happened to parents that impacts kids nearly as much as it is how parents have made sense of it. And it is even helpful on an appropriate level. A lot of parental discretion is needed here. But what research shows is when you share your personal narrative, even parts that we would intuitively think we shouldn't, you decide, you use discretion. You don't have to tell the whole story, but your personal narrative is part of your kid's personal narrative. So, and also when they hear you sharing stories about your life, they don't have to feel shamed by things that have happened to them, that bullying story that's part of what has made them who they are. But notice that if you are struggling and you're not engaged with your kids, we need serve and return relationships. They engage with you. You got to be present and engage back. Or else kids' sense of self, ability to integrate their experiences, take all the experiences they've been through and see how that story accumulates into who they are. and epigenetic expressions. Our DNA is a blueprint. It is awaiting instructions from the environment. This DNA can take this path or this path, depending on what it's exposed to. A nurturing relationship, which I know if anybody's watching this, y'all are invested parents. You can help impact the way the DNA, I pass this gene on to my kids. The love, the nurturing, the engagement goes a long way toward telling that DNA to take this route. So, but if it's untreated, kids are more likely to be prone to PTSD after trauma, struggle to repair conflict. Do they know how to repair relationships? If mom and dad have an argument and the kids saw it, you want to intentionally talk about what you're doing to repair it as part of your house rules. Really struggle with relationships, jobs, holding jobs, bringing out negative behaviors in others, the instigator kind of thing that it feels like, but really it's part of this issue that they've been dealing with. Be detached and dissociate. So you deserve to take care of anything that you've not taken care of in yourself. Self-care, you deserve it. It also will benefit your kids tremendously. Okay, let's move on. So I wanted to share, this is more about that personal narrative, autobiographical memory. You see the little boy on the left, he's trying to remember a story from 5 years ago. See how fuzzy it is? Mm-hmm. And then the girl on the right, and he's so troubled by that. He's going to have trouble with, who am I? How did I get to be, what's my story? Whereas this little girl can think back with clarity about what happened. You may notice a link between, there's also a link here between this and narrative skills, even literacy skills. How well do your kids tell stories? So you can practice storytelling by reading books and having them retell it, dialogic reading. What happened? How do you think the characters felt? And then bring it around to their story. Bring out videos, bring out old photos and talk about the stories and then elaborate. How did you feel when we went horseback riding? You always want to pull feeling into it, but you want to revisit these things. It's great to do this with anybody in the child's life, grandparents, parents, siblings. The more you kind of rehearse these stories, not in a, I'm going to memorize this way, but the more all the pieces of who I am and how I came to be the person I am today makes sense. How much confidence does that grow? It helps problem solving skills, because when I have a cohesive narrative, I can think back, use my background knowledge, think back to a time I faced that situation. Last time I made this choice, that didn't turn out very well. It helps inform my decisions in the future. Social problem solving. How can I have self-esteem if I don't know who I am? Our story, our memories are part of who we are. It helps emotionally regulate, psychological well-being. But trauma, if it's not been dealt with, autobiographical memory tends to be very vague, overgeneralized, fragmented, just bits and pieces that don't tie together. Imagine how that relates to brain architecture and being able to see the big picture and how the details fit into it. Less integrated identity. Wait, I thought I was a baseball player. Wait, I'm also a brother. How do those things go together? Insecure attachments and increased trauma. So it is so important to practice storytelling. It can be retelling a movie, it can be books, but then it's so important to include the family story, this child's story. All right.
Oh my gosh, I love all of this. This is such great advice. I actually don't think I do that with my kids at all. I need to.
I don't think it's something that people are just like, we're going to work on autobiographical memory today. I mean, it's not, it's not just something that's obvious. Yeah. But it is powerful. It is so, so powerful.
Yes.
Of course, journaling with this is great too. But liking myself and being comfortable with my beliefs, part of how kids can really get to know who they are and enjoy better mental health is to appreciate the different sides of self. My unique self. What are my interests, my likes, my dislikes, my hobbies, my culture, the family norms, values, opinions, my positive self. What are my strengths? We want to support the struggles, but celebrate the strengths and give them opportunities to really exercise those and cultivate those. Coherent self. This is very important when you think about, who was I before this thing happened to me? Who do I feel like I am now? It's probably had, depending on where you are in the phases of going through something like that. These are things I want to work on because I want to get that joy and that sense of humor back. This is a way that I'm stronger for next time. this is important with adoptive families. Because part of identity, and it is no reflection on the love a child has for adoptive parents who have absolutely changed the life of the child you've adopted. But part of their identity is where they came from biologically, and then who they are in your family. And they need to know it's okay to be curious about that, and that you celebrate all parts of them. There's also what you put out, who are they putting out to the world versus are there any dichotomies between what they feel that they convey to the world? If so, why? We all have different hats we wear. I mean, we're going to have different conversations with a best friend than we do with our doctor, than we do with the preacher, than the next door neighbor. That's natural. That's appropriate. That's pragmatic language. But are there any dichotomies that are kind of mutually exclusive, and why? And then encouraging kids to think about their future self. You mentioned hope earlier, and that's what this little boy has done. He drew a picture of himself now, and then years and years from now, who are you 30 years from now? And he came up with some ideas. There was an amazing study about from Dr. Shane Lopez. He was one of the foremost authorities on hope, and they asked through Gallup over 10 million people around the world, do you think the future will be as good as or better than the present? 90% said they think it'd be better. But when asked, do you have the competencies to get you from point A to point B where you want to go? That number dropped to 50%. What would that number be for individuals struggling with neurodevelopmental challenges? But what gives hope? I mean, autonomy, competence, mastery, connection, purpose. Why does this matter to me? I am doing this because it's core to who I am. How do I know what's core to who I am? By the things we've been talking about doing to cultivate that. But when there have been experiments where there's an app on a phone where you can take a picture and it ages them 30 years. We tend to treat our future self as a stranger. When you start really thinking about future you start treating them as a friend and making better choices. So this is extremely powerful. And that's an abstract concept, but seeing that picture makes it concrete. And that's really helpful for kids a lot of times.
I love that. I don't want any piece of that app, though.
No, I don't need to be looking at 80 right now. I don't think that's quite appropriate.
I'll draw that
for my age,
like that kid.
When I'm 80, let's bring it on, but not right this second.
I love it. As you can see there, we've got all the brain balance centers. And like I said in the beginning, you can follow Heather at The Hidden Churn. Each week, she also talks with a wonderful doctor. Are you going to be talking to Dr. Brian this week?
Yes, Dr. Brian Aspie and I will be back Thursday at 3:30.
Amazing. And if you want to catch us, if you're just catching on to the end of this, come back and watch the replay. We are here every Monday chatting about different things. And this month, we're focused on mental health. So make sure that you stay tuned. Heather would like to do several parts just to help all of us really have a little bit more comfort and ease, and honestly, just some tactics to go about our daily life and make it a little simpler. Heather, thank you so much.
Thank you, Jen. And thanks for everyone who shared your time with us. Hope you have a great week.
All righty. We'll see you next time.
Bye.